Hello, it's Dr. Joseph Aiello from San Diego Center for Integrative Family Medicine, and today I want to introduce Chris Feuge, who is the owner of Cypress Diagnostic Imaging. And the reason why I'm bringing him into this office and to do an interview is because we want to introduce a screening test as a preventive screening test, and it's called Carotid Intimal Medial Thickness Testing. And it's an ultrasound test that looks at your carotid arteries. And the reason why we do it is we want to see if there's any plaquing or any collection of clots or anything going on in the carotid arteries that may be an indication that you have something going on in your arterial system that we might get ahead of. And with that being said, I want to introduce Chris Feuge, the owner, and so we're going to be doing the testing on August 12th.
Yes, correct. Starting at 9 o'clock.
Starting at 9 a.m. Okay,
yeah.
For a couple hours, and so tell me what's involved with doing that.
Well, the test it's a simple test. It takes about 10 to 15 minutes, and we use ultrasound. And so, as you know, ultrasound is radiation-free, it's painless, it's non-invasive.
Okay.
And we're actually going to run a video loop using ultrasound on both the left and the right carotid. And so we're really looking for three things. So we're going to measure the intima media thickness. So, each artery has three layers of it, the intima, media, and adventitia. And so we're going to measure the thickness between the intima and the media.
Okay.
And so everybody's got some thickening in between the intima and the media, but if it's thicker than it is for your age and gender, then you have an early stage heart disease or atherosclerosis.
So these are the big arteries that go from your heart up to your brain.
Correct.
So we don't want those to be clogged.
No. And we know also that if you have any plaque developing in your carotids, there's also about a 70 to 80% correlation that you would have plaque in the coronary arteries of your heart.
That was my next question.
Yes.
So we do know that there is some correlation between clotting here and clotting in your heart.
Correct.
So that would be good to know.
Right.
And then, okay.
So the test is really, like I said, it takes 10 minutes. We run a video loop of your carotid arteries, and it's going to tell you the thickness of your intima media. It's also going to look for stenosis, which is any plaque buildup, and it'll show you if there's any plaque protruding into the lumen, which is the opening of the artery.
Oh, okay.
And then it'll tell you what type of plaque you have, whether you have calcified plaque or soft plaque. Soft plaque is vulnerable to rupture, which can cause heart attack or stroke.
Okay.
And so that's another indication. So I think that the best part of the test is that people do have heart disease or early stage atherosclerosis, and they're not even aware of it because they have no symptoms.
Right. So there could be some stenosis, which means that the size of the artery has been decreased because of blockage or some swelling of the intima media.
Correct.
And there's enough blood flow that they don't get any effects from it.
Right.
But down the road, it could build up to the point that they have bigger issues.
Correct. So we'll be able to identify if they have any stenosis, what type of plaque it is, and how thick their IMT is. And we actually provide images on it comes with a very simple 5-page report, but patients will actually get pictures of their arterial walls. And so that, I think, is the battle that we face, and most people don't even realize it, that there is plaque and things happening in the wall of the artery, but people have no symptoms. They don't even know about it.
Right.
So with this simple test, it's going to tell you, do you have plaque? How bad is it? And then once that report comes back, that's one of my favorite parts, that it engages patients to talk to their doctors.
Sure.
And now you can, number one, assess their risk for a heart attack or stroke. But number two, now you can take a more preventative approach to healthcare.
Right.
You can make diet recommendations, exercise recommendations, medication changes.
Just because they have thickening doesn't mean they necessarily need some procedure done on it.
Correct.
But we can look at it and say, okay, now you need to address what are you eating? What's your inflammatory markers? What are those doing?
Correct.
What's your nutrition? What's your exercise routine? How's your stress levels?
Right.
All those different things that become components of contributing to the atherosclerosis or cardiac disease.
Right.
So that's good. That would be good to know.
And we actually find when patients actually visualize the plaques in their arteries, compliance can increase up to 70%. Because a lot of times they're thinking, well, I'm going to wait to do something, but now that they see it, okay, I have disease, and it's happening, and it started, now I want to be more preventative.
I've seen that when I do blood tests on people and show them black and white. This is real instead of just talking about it.
Right.
That makes a big difference in how they approach their health.
Right. And so then, and So it really offers two things. You can be more preventive and aggressive with, preventative measures.
Sure.
And also at the same time, it may offer you peace of mind.
Right. If everything's good and you're worried, that
Right.
can take that off your plate.
Right. And if you do find disease and you start to change medications and diet and your exercise habits, now you can come back in a year or two and measure it again.
Right.
And see progress and changes and get it under control.
So would you expect changes 6 months or wait a year or what?
Depends on the report. So if people come back and it's more serious, it's a simple to interpret report. It's A, B, C, D, E, F, just like a report card. And so if you have C's and D's and E's, you may want to come back in 6 months or a year.
Okay.
But if it's A's and B's, probably 2 years.
Okay.
But
all right. And
so I would say that, the other thing is that, like we were talking about, that heart disease typically, and early stage heart disease, has no symptoms.
Right.
And so, Cypress is a SHAPE Center of Excellence for early detection of heart disease.
Okay.
And so, SHAPE guidelines recommend proactively screening males older than 45 and females older than...
Oh, sure. So the guidelines are...
Yeah, males over 45.
Whether you have symptoms or not.
Correct.
Okay.
And females 55 and over.
55 and over. Okay.
Yeah. And so, women really set the bar high with screening for breast cancer.
Right.
But, I think for every person that dies of breast cancer, 8 of them will die of heart disease. So heart disease, heart attack and stroke is the real risk for women.
That's much bigger. That's an important point, yeah.
And so it's a great simple test. It just takes about 10 minutes.
And it's painless.
And it's painless.
All right. Thanks, Chris. I appreciate